Health disparities, as defined by the Centers for Disease Control, refer to preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced by socially disadvantaged populations. The unequal distribution of hypertension across various racial categories is an example of such a disparity, and important because hypertension is a chronic disease with potentially devastating consequences. Looking at the distribution of hypertension prevalence across racial categories, it may be tempting to assume that race itself is a risk factor for hypertension. However, if we look at the individuals that make up the racial categories and consider non-racial factors of health, such as their experiences, backgrounds, and community environments, we can develop a more sophisticated perspective on this health disparity. For example, consider nativity, or where a patient is born. Within the Black patient category in the U.S., several studies have demonstrated that Black patients born in the U.S. have higher rates of hypertension than Black individuals born elsewhere who immigrated to the U.S. A similar effect on cardiovascular disease was seen in Hispanic patients born in the U.S. versus Mexico, though the U.S. considers Hispanic to be an ethnic rather than racial category. While the reason for the differences in health outcomes for individuals of the same race or ethnicity but from different birth countries is unclear, the differences in hypertension prevalence and health outcomes between these individuals are significant. Thus, it becomes difficult to address the health needs of individuals if we assume everyone from one race has had the same life experiences. Differences in life experiences influence health disparities. To better understand the broad disparities in hypertension across racial categories, it is necessary to explore the different factors that individuals experience that increase their susceptibility to disease. One such factor is health behaviors. Health behaviors such as tobacco use, alcohol use, physical activity, and weight play an important role in hypertension management and are addressed as part of the recommended lifestyle changes. Social and economic factors can significantly influence health prevalence and outcomes. These include education levels, income, and healthcare literacy. The type of work one is engaged in can impact health insurance coverage and the ability to take time off from medical appointments. Economic factors, such as ability to pay for care and medication, and being able to travel to a healthcare provider, can also lead to health disparities. Where a person lives can also lead to disparities in clinical care. Differences in the availability of healthcare providers and specialists, as well as the number of available appointments, can vary based on geographic location. This can create barriers to timely and appropriate health care for certain communities. Where a person lives and works can also expose them to negative environmental factors, such as poor air quality, access to healthy foods, and a safe environment to exercise. Cultural beliefs and trust can play a significant role in healthcare disparities. Patients' trust in their healthcare providers and their confidence in the recommended treatments can influence their willingness to adhere to hypertension management plans. Additionally, biases from healthcare providers may also contribute to disparities. Psychological factors also impact healthcare disparities. This includes stress and mental health disorders. Let's take a closer look at some example of these factors specifically impacting hypertension. Diet plays an important role in blood pressure control, with the DASH diet emphasizing the consumption of vegetables, fruits, whole grains, and low-fat dairy and animal products. In addition to diet, reducing salt intake and increasing potassium have been shown to reduce blood pressure. Diet is influenced by behavioral, cultural, and environmental factors. The choice to eat certain types of food or food that is a part of a person's culture impacts health. In addition, there can be differences in access to stores that sell a variety of healthy food options based on where people live. One example of how diet may be linked to blood pressure is the impact on nitric oxide. Studies have shown that some individuals have reduced ability to process nitric oxide in their bodies, resulting in increased susceptibility to hypertension. Increasing nitric oxide availability through diet has potential to mitigate high blood pressure. Some examples of food that increase nitric oxide are leafy greens, beets, and citrus fruits. If individuals do not have access to stores that sell fresh vegetables, this can impact the ability to have a healthy diet. One very specific form of social and psychological stress that has been shown to impact hypertension is incarceration and solitary confinement. Data from the Cardia study shows that incarcerated individuals and those who experience solitary confinement have higher levels of hypertension. This may be impacted by a higher propensity of those incarcerated to engage in unhealthy behaviors such as drugs or tobacco use. We know that hypertension can increase morbidity and mortality. Sustained high blood pressure can have dangerous effects on the cardiovascular system and kidneys. It can also have devastating consequences during pregnancy. Preeclampsia is a pregnancy complication characterized by increased blood pressure, proteinuria, and/or signs of organ failure. It is one of the leading causes of maternal morbidity. Non-Hispanic Black women experience higher rates of preeclampsia and more severe complications from preeclampsia than their counterparts, indicating that a health disparity exists. Given that we already know that non-Hispanic Black individuals have higher susceptibility to hypertension, would non-Hispanic pregnant Black women experience decreased adverse outcomes and mortality from preeclampsia when prescribed prophylactic treatment, increased and/or specialized postpartum follow-up care? In conclusion, many different factors, including diet and exercise, environmental and psychological stressors, and resources, both financial and medical, contribute to the development of hypertension. Communities with individuals who experience greater exposure to risk factors are more susceptible to hypertension, and this variability in experiences may contribute to the disparities seen in hypertension prevalence. Thus, while hypertension disparities can be simplified into racial differences, the reality is a more complicated and individualized patient journey. By assessing the individual patient's experiences, exposures, and resources, providers can refine hypertension treatment plans to offer individualized care that can ultimately improve health equity.